What is the difference between peptides and TRT? Because they are a lot of times mentioned together in the same clinics and so on. This video is sponsored by Mizumi, the #1 pick for men on TRT. Shop now at Mizumi's using the link in the description under this video.
Yeah. Well, that really depends. When people say that, they're talking about testosterone and growth hormone peptides. Because remember, we have over 7,000 naturally occurring peptide reactions. So we have peptides for everything. My color is melanotan 2, which induces more melanin in my skin. And that's why I look tan, because my natural color is whiter than you, believe it or not. You're going to ask my brother. I am white as Casper, but I use it for the anti-inflammatory properties for the brain. I love to spend time in the sun, so I don't have to put any toxic chemicals as the endocrine disrupting chemicals on my skin. I have a natural sun blocker, and plus I look tan. It's pretty cool. But so regard to your question, TRT and growth hormone peptides, when it comes to the anabolic side of it, they could be like cousins. They have that similarity. But when it comes to like longevity and creating other synergistic effects in the body, they can function very differently. Like, for example, growth hormone peptides don't stimulate your sex drive, which we know that TRT, one of the best things that it does, it increases your libido. Right. So in regards to anabolics, they relate to that. But in regards to the actual effect and properties of the medication, they're totally different.
And the way that I like to think about it, Stephen, like sort of like in layman's terms, is, you know, in life, there's necessities and then there's luxuries, right? So when we're talking about, you know, and this is a paradigm shift for a lot of people, right? So when we're talking about health optimization, right? Normal is not optimal, right? But so when we're talking about health optimization, you know, we have to take care of your necessities first. So if you're testosterone deficient, then that's a necessity. Yes. We have to cover that.
Fundamentals.
If you're low on vitamin D, if you're low on DHEA, these are necessities that you're gonna have to continue long term, because you know they have a wide range of benefits, and it's usually our fundamentals, right? Testosterone is a fundamental. I mean, do you need a growth hormone releasing peptide? You don't need it. It's wonderful. They're awesome, but they're, you know, I like to think of, like I said, necessities and luxuries. Necessities, you have to continue. Luxuries are nice things that we should give ourselves as a gift every now and then, maybe 2-3 times a year. And also peptides are a lot more goal-oriented, right? Like you have to be very specific about what you're looking for, because like, you know, like Michael said, there's peptides for pretty much everything. So it depends what you really want to do. Like, for example, when someone calls me, and like you said, you know, the most people have heard about the growth hormone releasing peptides, right? Those are the most popular. So when people call me for those, I always like to say, look, I'm happy to talk to you about it, and we're happy to start you on a peptide therapy, but you have to guarantee us at least one thing. If we're talking about growth hormone peptides, you're going to have to guarantee me that you're going to give me at least 3 days a week where you're going to give me a good training routine. Because if not, then, you know, this is not a magic potion. Like you have to do your work and you're going to get mediocre results, right?
No, but there's also things like your insulin, your glucose, your hemoglobin A1C, your lifestyle. You know, there's a lot of things that will determine when peptides can be used. They're very delicate and they work, but you first have to prime the system in order to respond well to them. So a lot of people, you know, they think they're going to take a pill and they're going to get a six-pack or something like that, which is what most people want. It doesn't work that way when it comes to this. Where I have seen that GH peptides are very beneficial in comparison to TRT is if the patient is having sleep disturbance issues, they can take the DSIP or a GH peptide, which induces deep wave sleep. So yeah, it could help to restore wave cycle. I mean, deep wave cycles.
Right.
So sleep deep wave cycles, excuse me. Yeah. So they are very beneficial, again, when used appropriately. Yeah. But
and used in complementary form to your TRT therapy. Yes. Like you're not, you know, you shouldn't give one up for the other. It's just a complementary therapy.
As we like to describe it, and I got this actually from Jay, but I love it. It's like having a tool belt. Testosterone is the hammer jack. I mean, jackhammer. Yeah. Sorry, jackhammer. So you can do a lot of damage with it, but you're not going to show up to a construction site just with a hammer because you're only going to be limited to specific things. There's other tool belts in the toolbox that have specific functions. And that's where we see peptides and other things like DHEA, pregnenolone, the vitamins, which are add-ons, but they have a much better impact when used together if needed.
Much more goal-oriented.
Yes.